Hi, Senator Lee. My name is Jennifer Walker. I'm a registered nurse with experience in cardiac, pulmonary, and hospice care. I'm a constituent of yours. I live in your district in Wilmington, North Carolina, and I'm currently completing my Master's of Nursing Education at the University of North Carolina at Wilmington. I want to thank you for taking the time to listen to these remarks today. I am here to advocate for North Carolina Senate Bill 537, which is APRN definitions. This bill puts advanced practice registered nurse roles into North Carolina law and clearly defines what they are trained and allowed to do. It also removes physician oversight requirements and makes it clear that APRNs practicing within their scope are not engaging in the unauthorized practice of medicine. Senate Bill 537 allows APRNs to practice to the full extent of their certification and education. In my practice, I see both sides of the access issue. There are times when care is limited by how it is structured, but there are also clear provider shortages. Just recently, a colleague of mine was too sick to come to work, but she couldn't see a primary care doctor because she couldn't get in, and she couldn't see a specialist in a reasonable time frame. She wasn't sick enough for the emergency department or the urgent care, but she also wasn't well enough for work. This really stood out to me as an example of how limited access to care can be, even for someone who's working in the healthcare system. Experiences like that are exactly why expanding access to qualified providers matters. The evidence supports what we are seeing in practice. States with full practice authority have greater access and provider availability in primary care shortage areas and improved access to services. Removing practice restrictions is associated with better distribution of nurse practitioners in underserved areas and more timely access to care. From a systems perspective, supervisory requirements add administrative burden and can delay care, while full practice authority allows for more efficient use of the healthcare workforce. Most importantly, patient safety is not compromised. I understand that some physician organizations have concerns about removing supervision requirements. Those concerns are important to consider. However, the current evidence does not show that full practice authority negatively impacts patient care or safety. I understand that Senate Bill 537 is now in the Rules and Operations Committee, which you serve on. Because of that, your role in how this bill moves forward is especially important. This bill also supports to improve efforts to improve access to care and strengthen the healthcare workforce across North Carolina. This is not about replacing one role with another. It's about using the workforce that we already have in a way that better meets patient needs. Senate Bill 537, APRN definitions, is a practical and evidence-based policy change. It improves access to care, reduces unnecessary barriers, and maintains patient safety. As your constituent and as a nurse, I respectfully ask that you support this bill, because improving access to care is not just a policy issue. It is something patients feel every day. Thank you for your time and for your service to our community.